Hello, my name is Sun Tham, and this is my semester project for the case study. Current illness or problem. Billy was admitted to the hospital for fatigue, headache, body aches, pain, and chills. He did not take the flu shot in over 4 years, but does have all required vaccinations. And his temperature was at 102 degrees Fahrenheit when admitted to the hospital. So this sounds like it is either the common cold or the flu. So let's compare and contrast the symptoms of the two. The common cold has a fever of 99 degrees Fahrenheit, while the flu has a fever of 102.2 degrees Fahrenheit. Headaches are common in both, and aches and pains are mild and in the common cold, while it is severe for the flu. The common cold have a slight fatigue while it is severe for the flu. Nasal congestion is common in the common cold and it is rare in the flu. And least but lastly, sneezing is common in the cold while it's rare for the flu. Medical family history. Billy is a 17-year-old male. He is fully vaccinated, except he hasn't had a flu shot in over 4 years. He is sexually active with a female partner who presents the same illness, has no medical history of disease or infection or any other pre-existing medical condition. His parents are healthy with no known medical history of disease or infection, but of course they all get sick every now and then, just like regular humans do. But in this case, Billy has complained of his sickness feeling a little different and more intense than usual, which raises concerns for himself, and therefore going to the hospital for help. Commentary Part 1. What diagnosis is most likely for this clinical presentation? It is most likely going to be the flu based on clinical presentation. So based on Billy's family history and symptoms that are present, there are a few choices that comes to mind for this diagnosis. He may be catching a common cold or a flu, wait, which are the common symptoms that Billy presents. To really find out what sickness Billy is experiencing, we will have to take lab tests in order to find out what truly is causing Billy to feel sick. So we will need to perform a laboratory diagnosis for influenza, and it is typically performed using a variety of RIDT, which stands for Rapid Influenza Diagnostic Tests. We are testing for the flu first because it is the flu season, and that the fact that Billy has not taken a flu shot in over 4 years. So serious cases of the flu can result to pneumonia and other complications that can be deadly. This yields a very high chance that Billy has the flu. So the RIDT tests are tests that are inoculated by point of care personnel, and results will be given usually within 15 to 20 minutes. We can also diagnose this by taking a patient's serum antibodies against influenza viruses that can be also detected in blood samples. So what are the two of the main antigens of this microscopic parasite? It is hemagglutinin H and neuraminidase N. So the influenza viruses are surrounded by a lipid membrane envelope, which gives it strength and rigidity to the lipid envelope. And two of the main antigens of the influenza viruses are the spike proteins H and the N. These spike proteins have an important role in the viral infectious cycle. So H is a class 1 fusion protein. It has multifunctional activity as both an attachment factor and membrane fusion protein. And N is found in the surface of influenza viruses that helps the virus to be released from the host cell to infect other cells. Commentary Part 2. How can this microscopic parasite be transmitted? So the influenza viruses can be transmitted among humans in three ways. One way is that it can be transmitted by direct contact with an infected individual, such as a handshake, a kiss, or a hug. The second way is by contact with contaminated objects. This is called fomites, such as doorknobs, a public keyboard, or a brush. The third and last way is the inhalation of virus-laden aerosols. Aerosols are suspension of fine solid particles or liquid droplets that are in the air or in another gas. It can be natural or anthropogenic, meaning that a pollutant originating from a human. So the individual who is infected with the virus can sneeze into someone's face, and now that individual has high risk of getting infected with the virus. So, hypothesis how Billy may have been infected by this microorganism. So, since influenza virus is non-living, and it is way smaller than bacteria, but because of that, it is then considered to be a microbe. So, as described above, Billy may have been infected by this microbe in many ways. Based on Billy's history and current illness, it is likely that Billy may have been infected by his girlfriend, who presents the same illness. She might have sneezed or coughed around him, which causes spreading of the virus in the air and to nearby objects that Billy may have touched. But since Billy have not taken the flu shot in such a long time, this actually increases the risk of Billy to be infected and that he has less defense or immune reaction to these viruses. Prognosis. So which antibiotic treatment, if any, will be appropriate for this infection? So since the flu is caused by an influenza virus, antibiotic treatment unfortunately will not work for Billy, and that it is not appropriate to treat a virus. So antibiotics would be appropriate if Billy is experiencing an illness that is caused by a bacteria. So there are three drugs that can shorten the course of the disease by inhibiting influenza N activity. These drugs are inhaled zanamivir, oral oseltamivir, and intravenous peramivir. A more effective way to avoid the flu is through vaccination by yearly. What is the expected mortality rate for this condition, given the patient's medical and/or family history? The expected mortality rate for this condition varies by year and the strain of influenza virus that are infecting the population. Based on what I read, thousands of people die every year from being infected by the flu virus, so we can't really tell until the end and gather enough data worldwide. And what is Reye syndrome? Reye syndrome is a complication of influenza that occurs mostly in children and teenagers. This sequela, meaning that a condition which is the consequence of a previous disease causes swelling in the liver and the brain, this can progress to neurological damage, coma, or even death. Reye syndrome can also happen from the oral viral infections, such as chickenpox, and has been linked with the use of aspirin. So because of this, it is recommended that aspirin and products that contain aspirin should not be used to treat viral illness in anyone younger than 19 years old. Alright, so that's gonna be the end of this presentation, and this is the references. Thank you so much for watching. Please enjoy.